Are you seeking reliable information about Calquence medication? Look no further. This comprehensive guide has everything you need to know about its benefits and potential side effects. Calquence is a groundbreaking medication that has revolutionized the treatment of certain types of cancer. Its unique mechanism of action targets the underlying causes of cancer, offering new hope for patients. In this guide, we will delve into the numerous benefits that Calquence provides for cancer patients. From its ability to inhibit cancer cell growth to its potential to extend overall survival, Calquence is making a significant impact in the field of oncology. However, it is important to understand that every medication comes with potential side effects. We will explore the common and uncommon side effects associated with Calquence, ensuring that you have a comprehensive understanding of what to expect. Whether you are a patient considering Calquence treatment or a healthcare professional seeking more information, this ultimate guide is your go-to resource. Continue reading to discover the power of Calquence and how it can improve the lives of cancer patients. What is Calquence medication? Calquence, also known by its generic name acalabrutinib, is a medication that belongs to a class of drugs called Bruton's tyrosine kinase (BTK) inhibitors. It was approved by the U.S. Food and Drug Administration (FDA) in 2017 for the treatment of certain types of lymphomas, including mantle cell lymphoma (MCL). Calquence is usually prescribed for patients who have not responded well to other treatments or who have experienced a relapse. One of the key advantages of Calquence over other BTK inhibitors is its selectivity. Calquence specifically targets BTK, a protein involved in the growth and survival of cancer cells. By inhibiting BTK, Calquence disrupts the signaling pathways that contribute to cancer cell proliferation, leading to tumor regression and improved patient outcomes. Calquence is available in oral capsule form and is typically taken once or twice daily, depending on the prescribed dosage. It is important to follow the recommended dosing schedule and adhere to your healthcare provider's instructions to ensure optimal treatment outcomes. Benefits of Calquence medication. Calquence offers several benefits for cancer patients, particularly those with mantle cell lymphoma. One of the primary advantages is its ability to inhibit cancer cell growth. By selectively targeting BTK, Calquence disrupts the signaling pathways that promote the survival and proliferation of cancer cells. This can lead to a reduction in tumor size and potentially even complete remission in some cases. Another notable benefit of Calquence is its potential to extend overall survival. Clinical trials have shown that patients who received Calquence treatment experienced a significant improvement in progression-free survival compared to those receiving traditional chemotherapy regimens. This means that Calquence not only controls the growth of cancer cells but also improves the patient's overall prognosis. In addition to its anti-cancer properties, Calquence is generally well tolerated by patients. It has a favorable safety profile compared to other BTK inhibitors, with fewer reports of severe adverse effects. This makes Calquence a viable treatment option for patients who may not tolerate or respond well to other medications. How does Calquence medication work? Calquence works by specifically targeting and inhibiting Bruton's tyrosine kinase, BTK, a protein that plays a crucial role in the survival and proliferation of cancer cells. BTK is a key component of the B-cell receptor signaling pathway, which is essential for the growth and survival of B-cell lymphomas such as mantle cell lymphoma. When BTK is activated, it triggers a cascade of signaling events that promote cancer cell growth and survival. Calquence binds to BTK, preventing its activation and inhibiting the downstream signaling pathways. This disrupts the growth and survival signals, leading to decreased cancer cell proliferation and increased cell death. By specifically targeting BTK, Calquence minimizes the impact on healthy cells and reduces the risk of off-target effects. This selectivity is one of the key advantages of Calquence over other BTK inhibitors, as it allows for more effective and targeted cancer treatment. Common uses of Calquence medication. Calquence is primarily used for the treatment of mantle cell lymphoma, MCL, a rare and aggressive type of non-Hodgkin lymphoma. It is usually prescribed for patients who have received at least one prior therapy and have not responded well to other treatment options. In addition to MCL, Calquence is being investigated for its potential use in other types of lymphomas and leukemias. Clinical trials are currently underway to evaluate its efficacy and safety in patients with chronic lymphocytic leukemia, KIA, diffuse large B-cell lymphoma, DLBCL, and other B-cell malignancies. It is important to note that Calquence should only be used under the supervision of a qualified healthcare professional. Your healthcare provider will assess your specific medical condition and determine if Calquence is the appropriate treatment option for you. Potential side effects of Calquence medication. Like any medication, Calquence can cause side effects. However, it is important to remember that not all patients will experience these side effects, and the severity can vary from person to person. It is crucial to discuss any concerns or potential side effects with your healthcare provider before starting Calquence treatment. Some of the common side effects associated with Calquence include nausea, diarrhea, headache, fatigue, and muscle pain. These side effects are usually mild to moderate and can be managed with supportive care measures. It is important to stay well hydrated and follow a balanced diet to help alleviate these symptoms. More serious side effects, although rare, can occur with Calquence. These may include severe bleeding, heart rhythm abnormalities, infections, and allergic reactions. It is important to seek immediate medical attention if you experience any unusual symptoms or if your symptoms worsen. Precautions and considerations when taking Calquence medication. Before starting Calquence treatment, it is important to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. This will help ensure that Calquence is safe and appropriate for you. Calquence can interact with certain medications, including blood thinners, antifungal drugs, and certain antibiotics. It is crucial to disclose all medications, including over-the-counter drugs and supplements, to your healthcare provider to prevent potential drug interactions. Additionally, Calquence may increase the risk of bleeding. It is important to inform your healthcare provider if you have a history of bleeding disorders or are taking blood thinners. Your healthcare provider may recommend regular blood tests to monitor your clotting function while on Calquence treatment. Pregnant or breastfeeding individuals should consult their healthcare provider before taking Calquence. The safety of Calquence during pregnancy or breastfeeding has not been established, and the potential risks to the fetus or infant should be carefully weighed against the potential benefits of treatment. Dosage and administration guidelines for Calquence medication. Calquence is available in oral capsule form and is typically taken once or twice daily, depending on the individual's prescribed dosage. The capsules should be swallowed whole with a glass of water and can be taken with or without food. It is important to follow the dosing schedule provided by your healthcare provider and not to exceed the recommended dose. If you miss a dose of Calquence, it is important to take it as soon as you remember. However, if it is close to the time for your next scheduled dose, skip the missed dose and resume your regular dosing schedule. Do not take a double dose to make up for a missed one. It is important to store Calquence capsules in a cool, dry place away from direct sunlight. Keep them out of reach of children and pets. If you have any expired or unused capsules, consult your pharmacist or healthcare provider for proper disposal methods. Frequently asked questions about Calquence medication. Can Calquence be used as a first-line treatment for mantle cell lymphoma? Calquence is primarily used for patients who have not responded well to other treatments or who have experienced a relapse. It is typically prescribed after at least one prior therapy. However, every patient is unique, and your healthcare provider will determine the most appropriate treatment plan for you based on your specific medical condition and individual factors. Are there any long-term side effects associated with Calquence? Long-term side effects of Calquence are not yet well established, as it is a relatively new medication. However, ongoing clinical trials and post-marketing surveillance are monitoring the long-term safety profile of Calquence. It is important to discuss any concerns or potential side effects with your healthcare provider. Can Calquence be used in combination with other cancer treatments? Yes, Calquence can be used in combination with other cancer treatments, such as chemotherapy or immunotherapy, depending on the specific treatment plan determined by your healthcare provider. Combination therapy may enhance the effectiveness of treatment and improve patient outcomes. However, it is important to discuss potential drug interactions and side effects with your healthcare provider. Alternatives to Calquence medication. While Calquence has shown promising results in the treatment of certain types of cancer, there are alternative medications available for patients who may not respond well to or tolerate Calquence. These alternative treatments may include other BTK inhibitors, such as acalabrutinib, or different classes of drugs altogether, depending on the specific type and stage of cancer. It is crucial to consult with your healthcare provider to explore all available treatment options and determine the most suitable approach for your individual case. Your healthcare provider will consider factors such as your medical history, current health status, and treatment goals when recommending alternative medications. Conclusion. Calquence medication has revolutionized the treatment of certain types of cancer, offering new hope for patients. Its unique mechanism of action, targeting the underlying causes of cancer, has led to numerous benefits, including inhibiting cancer cell growth and extending overall survival. While Calquence has a favorable safety profile, it is important to be aware of potential side effects and take necessary precautions. By understanding the power of Calquence, patients and healthcare professionals can make informed decisions and improve the lives of cancer patients. Thanks for watching.